Welcome to our chapter dealing with the differences between scale-up research and large-scale implementation research. This chapter provides an overview of scaling-up frameworks, scale-up strategies, and approaches for monitoring and evaluation of scaling-up initiatives. By the end, trainees are expected to be able to conduct an intervention scalability assessment using a standardized instrument. Let's start by better defining what we mean when we talk about scaling up, and give an overview of scaling up frameworks. The World Health Organization defines scaling up as deliberate efforts to increase the impact of health service innovation, successfully tested in pilot or experimental projects, so as to benefit more people, and to foster policy and program development on a lasting basis. Scaling up complex health interventions to large populations is not a straightforward task. Without intentional, guided efforts to scale up, it can take many years for a new evidence-informed intervention to be broadly implemented. In the realm of implementation science, the terms spread and scale-up have often been used interchangeably. Nonetheless, a distinction exists between the two concepts. Spread refers to the adoption and replication of an intervention, while scale-up specifically addresses the broader systemic or infrastructural requirements necessary to facilitate comprehensive implementation. It's important to differentiate between the two. The process of scaling up, or replication, is the gradual spread of a large-scale intervention within a system. The concept of large-scale implementation involves the immediate and complete integration of evidence-based interventions, along with addressing accompanying system and policy challenges from the outset. For the past decade, researchers and implementers have developed various models and frameworks of scale-up. Let's look at a few frameworks, which are often used in implementation science. The ExpandNet framework for scaling up. The pathway for scaling up public health interventions. And the framework for scaling up health intervention. We'll start with the ExpandNet framework for scaling up. This framework portrays scaling up as a system consisting of 5 constructs: the innovation, the user organization, the environment, the resource team or organization, and the scaling up strategy, all of which interact with one another. The framework focuses on evidence-informed interventions that are scaled up at the organizational level. Let's have a quick look at the 5 constructs in the ExpandNet framework. The innovation refers to a set of health service interventions being scaled up. Once an intervention has been tested, it serves as a model to be scaled up. The intervention can be a new technology, behavior change program or media, operational procedures, training curricula, management and information systems, new services to unserved population, among others. The user organization refers to the institutions or organizations that seek, or are expected to, adopt and implement the innovation on a large scale. The environment refers to the social, cultural, political and economic context in which scaling up takes place. The resource team or organization refers to the individual and organizations that seek to promote and facilitate wider use of the innovation. Scaling up strategy refers to the plans and actions necessary to establish the innovation in policies, programs, and service delivery. Strategic choices have to be made in the following areas. The type of scaling up. Dissemination and advocacy. The ways to organize the scale-up process. Assessing costs and mobilizing resources. And monitoring and evaluation. Next, let's review the framework for scaling up health intervention. This framework is applicable for evidence-informed interventions that are scaled up at the individual and organizational levels. This framework defines 4 phases to get to full-scale implementation. First, the setup phase. At this phase, the intervention is introduced to the health system, including the target and objectives of scale-up and what needs to be scaled up to achieve full scale. Initial test sites, early adopters, and potential champions are identified within this phase. The next phase is to develop the scalable unit. The scalable unit is the smallest representative facsimile of the system targeted for full-scale implementation. It is usually a small administrative unit, such as subdistrict, district, or village, which includes key infrastructural and political components, which influence the process of scaling up. This phase aims to test local ideas on how best the implementation could be implemented, so that when the intervention is introduced, we can understand the setting and context. The output of this phase is the development of context-sensitive strategies that can be tested and refined in other various settings. The following phase is that of testing scale-up. The successful, early, intervention demonstration, in the previous phase, needs to be tested in a broader range of settings prior to full-scale implementation. In this phase, we also test the infrastructure, such as the data system and supply chain, and the human resource capacity and capability, for example, leadership, management, and frontline staff. Finally, we arrive at the phase of going to full scale. The well-tested evidence-informed intervention is deployed in this phase, supported by the infrastructure and the human resources that have adapted the intervention. This framework also draws attention to factors which influence adoption and should be identified during the setup phase, including leadership, communication, policy, culture of urgency and persistence. This framework also draws attention to support systems, which encompass human capability for scale-up, infrastructure for scale-up, data collection and reporting system, learning systems, and design for sustainability. The last framework we'll review is the pathway for scaling up public health interventions. According to this framework, the scaling up process consists of 4 stages. The development stage identifies the program development process, including whether or not it is based on a theory. The efficacy testing stage identifies whether the intervention was pilot tested in an ideal controlled setting to assess its efficacy. A real-world trial examines the scaling up process, including the implementation of real-world trials of the intervention across multiple settings. This can be described as field testing or replication. The dissemination stage identifies whether the intervention was disseminated at a population level, including whether it was adapted, institutionalized, or commercialized. Based on this framework, there are 4 types of scaling up pathways from a systematic review of various intervention scale-up processes. Type 1, comprehensive. This type is adhering to all 4 stages of scaling up. Type 2, efficacy emitter. The scale-up process did not test the efficacy of the intervention. Type 3, trial emitter. The real-world trial was not conducted. Type 4, at-scale dissemination. Intervention proceeded directly from development to dissemination, skipping both efficacy testing and real-world trials. The frameworks we reviewed are useful for guiding efforts to scale up, but need to be complemented by practical strategies. There are at least 5 strategic activities to consider: designing scalable innovations, planning scale-up, persuading the government to adopt and finance innovations, supporting government implementation, and promoting community acceptance. Designing scalable innovations means getting an innovation right from the start. It's critical to allocate time to incubate ideas, evaluate and refine innovations, and identify the most scalable elements. Aim to design interventions with essential attributes: relevance, effectiveness, observable benefits, acceptability, simplicity, low cost, alignment, and sustainability. Planning for scale-up involves integrating scale-up considerations into program design and enhancing implementer capacity. This requires expertise, dedicated time for evaluation, advocacy, communication, a robust track record, credible evidence, integrity, charismatic leadership, established relationships, and the ability to manage substantial grants. Persuading governments to adopt and finance interventions requires effective advocacy and communication of evidence. Engage with officials, rally support from policy champions and networks, and ensure alignment with the government's strategic goals. Assisting the government in implementing interventions at scale involves serving as technical partners. This includes offering evidence for decision-making, collaborating on policy strategies, guidelines, tools, protocols, manuals, and training curricula to ensure interventions meet target population needs and government objectives. Encouraging community acceptance involves collaborating with influential community figures, opinion leaders, like community groups, women's associations, traditional and religious figures, and using various communication channels. Establishing community mobilization teams or training role models can also promote engagement. Strategic decisions may vary depending on whether the goal is to scale up an intervention or achieve large-scale implementation. For scale-up, focus on designing scalable innovations. For large-scale implementation, prioritize supporting government efforts to scale up the intervention. Developing and implementing a robust, comprehensive monitoring and evaluation plan will help practitioners operationalize their scale-up strategy. The plan allows for well-defined benchmarks to be set and progress towards established goals to be tracked. This includes both the expansion of services, that is horizontal scale-up, as well as integration of the evidence-informed intervention into systems to achieve sustainability, vertical scale-up. The monitoring and evaluation plan should also allow for the testing of scaling-up strategies, and help to provide evidence for strategies implemented to support scale-up or large-scale implementation, depending on the primary approach for scaling up the evidence-informed intervention. Using collected monitoring and evaluation data, rapid feedback cycles allow the research and user teams to make systematic changes to the evidence-informed intervention and the scale-up process. Gathered over successive points in time, data is fed back to the resource team and shared with stakeholders at all levels. Data may lead to discussions about how to improve, adapt, or simplify aspects of the intervention, when to modify necessary implementation supports, or how to garner more demand for the intervention. Decisions may then influence non-essential components of the evidence-informed intervention, scale-up process, or a variety of implementation supports. A strong monitoring and evaluation system for scale-up encourages a planned, deliberate, active and iterative process, which is more likely to achieve success in implementing and sustaining the evidence-informed intervention over time. Following this approach, implementers and stakeholders work together to identify what is needed to expand and sustain the intervention, collectively setting, and then monitoring, benchmarks along the way, as well as collecting data to determine whether the intervention is implemented with fidelity and is having the expected impact at scale. An assessment of the evidence-informed intervention for their suitability for scale-up could be a major step in developing an implementation research study with a scaling-up objective and relevant monitoring and evaluation plan. The Intervention Scalability Assessment Tool, ISAT, was developed to support policymakers and practitioners to make systematic assessments of the suitability of health interventions for scale-up. The ISAT consists of 3 parts. Part A, setting the scene, requires consideration of the context in which the intervention is being considered for scale-up. Part B asks users to assess the potential implementation and scale-up requirements. And Part C generates a graphical representation of the strengths and weaknesses of the readiness of the proposed intervention for scale-up. Although the ISAT is designed to be a health policy and practitioner tool, it can also be used by researchers in the design of research to fill important evidence gaps. Let's take a moment to summarize what we have covered in this chapter. The World Health Organization defines scaling up as deliberate efforts to increase the impact of health service innovation, successfully tested in pilot or experimental projects, so as to benefit more people and to foster policy and program development on a lasting basis. In the realm of implementation science, the terms spread and scale-up have often been used interchangeably, despite a distinction existing between the two concepts. Spread refers to the adoption and replication of an intervention, while scale-up specifically addresses the broader systemic or infrastructural requirements necessary to facilitate comprehensive implementation. The process of scaling up or replication is the gradual spread of a large-scale intervention within a system. The concept of large-scale implementation involves the immediate and complete integration of evidence-based interventions, along with addressing accompanying system and policy challenges from the outset. The different frameworks used for scale-up are: the ExpandNet framework for scaling up, the pathway for scaling up public health interventions, the framework for scaling up health intervention. The frameworks we reviewed are useful to guide efforts to scale up, but still need to be complemented by an understanding of practical strategies to scale up evidence-informed interventions. There are at least 5 strategic activities which need to be considered: designing scalable innovations, planning scale-up, persuading government to accept, adopt, and finance innovations at scale, supporting and enabling government to implement innovations at scale, and promoting community acceptance and uptake of innovations. Developing and implementing a robust, comprehensive monitoring and evaluation plan will help practitioners operationalize their scale-up strategy. That's it for this chapter dealing with the differences between scale-up research and large-scale implementation research. Before you go, take a moment to consolidate what you have learnt by putting it into practice. Download this chapter's supporting resource material and complete the activity there. Once you have completed the activity, please join us for Chapter 13, where we will learn about how to use the information garnered through implementation research.